Hi there, my name is Rebecca Faust, and this is my presentation for NURS447 on nursing burnout. What is burnout? Burnout syndrome is defined as a consequence of chronic stress in response to emotional and physical stressors present in the work environment, according to Sear et al. 2022. So why is burnout an issue? 62% of nurses report experiencing burnout, and 31.5% of nurses report that nursing burnout is the reason behind leaving their place of employment. Nursing burnout results in overworked nurses and contributes to the epidemic in the nursing shortage. This is a photo of me from my graduation in 2019 when I finished my ADN program. As a new grad, I accepted a position on a med-surg/tele floor. I was working nights. I realized pretty quickly that this was not the job for me. It got to the point where I hated going to work so much that I would literally just count down the hours until I had to be back there. The only thing I enjoyed about my job was the fellow nurses that worked there. The management was poor, the doctors were not nice, we were constantly understaffed, and I was consistently taking 6 to 7 patients, med-surg patients, as a new grad every single night, while the more experienced nurses were assigned for telemetry patients. I recognized the signs of burnout in myself and only stayed in this position for 6 months. According to the World Health Organization published in 2019, the symptoms of burnout include mental and physical exhaustion, mental distance from the job, cynicism about the job, and reduced efficacy in the workplace. The risk factors included for nursing burnout is a stressful work environment, poor relationships with physicians and coworkers, increased workloads, lack of support from leadership, sleep deprivation, increased number of hours worked per week, and moral injury. As nurses, we can bear a heavy load on our shoulders due to the amount of empathy we give others. Unfortunately, this chips away at your mental state and makes you begin to question your values as a person. Patient care is the central value for nursing. So how does burnout impact patient care? It will impede patient safety, decrease quality of care, decrease nurses' organizational commitment, decrease nursing productivity, and decrease patient satisfaction. These all contribute to nursing burnout and increased staffing shortages. Nurses who work the industry standard 12-hour shifts are 2.5 times more likely to experience burnout than those who work shorter shifts. So how do we prevent nursing burnout? Knowing the signs and symptoms of burnout, open communication with managers on feelings, practicing self-care, working towards a more positive work environment, and utilizing employee assistance programs are all ways to help prevent nursing burnout. In the event that you recognize nursing burnout in yourself or your coworkers, there are ways to help. These 7 techniques are proven to help combat nursing burnout. Number 1, mindfulness. This might include incorporating meditation or gratitude into your daily routine. Number 2, healthy sleeping habits. Prioritizing 8 hours each night and creating a healthy sleep routine for yourself. This might include no electronics 30 minutes before bed, reading a book, or a nice skincare routine. Number 3, eating well. Ensuring that you're providing yourself with a healthy, well-balanced diet. Number 4, asking for help. This includes not just family and friends, but a professional if need be. Number 5, incorporating a regular exercise routine into your weekly activities. Number 6, take a break. Use your vacation days, even if you're just staying home. Find a hobby or a club, anything to interest you, and just let your mind rest. And lastly, number 7, request training. If parts of your job are giving you anxiety, requesting training can help alleviate some of the stress that comes along with workplace. This is some of my favorite resources for help when it comes to alleviating nursing burnout, but also promoting mental wellness. One of my absolute favorite ones is the Happy. It is a movement geared specifically towards nurses and healthcare professionals. In summary, nursing burnout is a relevant and everlasting issue in healthcare, but prioritizing yourself helps to reduce the burden it brings to nurses every day. Recognize the signs and the risk factors, seek guidance on how to deal with burnout, and remember that you are more than your profession. If you're interested in learning more about nursing burnout, here are the included references from my presentation. Thanks for listening.